Today we're going to present an update on where we are in the trajectory of our pandemic here in British Columbia and some of the data that we're using, and then we'll go through our usual report. So to start with, the epidemiology of what has happened in our pandemic and bring people up to date. This represents the geographic distribution of cases of COVID-19 by what we call the health service delivery area, so a larger health grouping, updated until the blue graph is the number of cases we've had since January, the cumulative geographic distribution, and the one on the right, the yellow and orange, includes the past 7 days. And as you can see, the progression of the pandemic really has been concentrated, or the largest number of cases have been concentrated in the Fraser region, with some, of course, increase in interior health and in the north. As the number of cases of COVID-19 have increased over the past number of weeks and months, we are now able to present data by local health area, and that is a more granular understanding of where cases have been. And I will remind people that this is our average daily rate per 100,000 population, and local health area is represents the communities where people live who have tested positive for COVID-19. So that is our convention across the country, that we report by where people live. It may not reflect where they have been exposed to COVID-19, because we know that that can happen if people are traveling, if they've been to other places, if they work in different areas from where they live. But it does give you a good representation of the areas where we have the highest rates of COVID-19 in the province right now. This is an update of the data from the last week, from December 15th to 21st. We had a little over 4,000 new cases that week, and then it was one of the most difficult weeks for us in that we had 109 people who died from COVID-19 in the week of December 15th to 21st. On the bottom of this graph, what you see is our epidemic curve with what we call the 7-day rolling or moving average. And that helps smooth out those daily case reports that we give every day and help us understand what the pattern of what pattern we're seeing in terms of numbers of cases and the trajectory over the weeks. As you can see, we did hit a peak around mid-November, and we've now started to slowly decrease. This is our epidemic curve, an update of the epidemic curve by reported date since January. So this is by the date that the test result is reported. And this breaks it down by the colors represent the different health authorities. Not surprisingly, what we can see is that Fraser Health Authority is where most of the cases live for COVID-19, particularly more recently, although we have also had substantial numbers of people infected with COVID-19 who live in the Vancouver Coastal Health region, and more recently peaks in interior health and the north. The dotted line on the top represents, again, the 7-day rolling incidence of cases per million population, which again peaked in the middle of November and has now again started to drop. We've presented regularly on the likely source of infection by people's episode date, and by that we mean the day of their onset of illness. And this speaks to the public health investigations of every single case. Most of our cases continue to be directly linked to a known case or a cluster or an outbreak. And we've managed, even though we have struggled in some places, particularly in Fraser Health in the last number of weeks through November in particular, we do manage to get the vast majority, understand where the vast majority of people have been exposed, and the vast majority of those exposures are linked to cases that we know. So that's important for us. It means that we have not lost our ability to do contact tracing and to identify outbreaks as early as possible, although we have been delayed in some areas, certainly now in the north as well, where we're having challenges keeping up. This is an important representation as well of the pandemic since January and the impact on different age groups in British Columbia. What we can see is that the vast majority of cases, particularly in our second wave, are in people who are from 20 to 39 years of age. Those are the green lines at the top. But also, very importantly, we've been watching carefully the trajectory in school-age children, and that's represented in two different lines here on this graph. The blue line at the bottom, 0 to 9 years old, and the 10 to 19-year-olds in the darker blue, slightly higher up. As we can see that those still represent a smaller proportion of cases overall, and they follow the same trajectory that we have seen with everything else, lagged slightly. But also we see that when we put in the restrictions that we put in November, all age ranges came down, particularly important to follow those who are school-age children, who also we saw a decrease in incidence in those age groups. The next set of pictures tells about the daily case rate, so the number of people testing positive per million population, and the figure up on the top left is for all of British Columbia, and that reflects how we have been doing in terms of daily case rates and the percent who test positive. So the different colors represent the percent of tests that are positive. The gray figure in the background represents our testing rate. So this puts a whole lot of information into one graph. And what it tells us is that we had an increasing rate of testing, we had an increasing rate of positivity into November, and we've now started to see a decrease. And that has been particularly apparent in Fraser Health, in Interior Health, and in the North, where the rates still remain high. We've seen a decrease in Fraser Health, particularly in the recent weeks, as well as in Vancouver Coastal Health. And on the bottom right, and on Vancouver Island Health Authority, it has stayed very low, despite increased testing for the last few months. We've done the same thing to look at how the trajectory has moved by age. And we've broken it down so that we can isolate what is happening in school-age children as well. So there are two graphs that look at 5 to 12 years of age and 13 to 18 years of age. And the gray in the background shows us that we did a lot of testing in that age group, particularly as school restarted in September, October, and into November, and that our case rates remained very low. But as case rates in the community increased, we saw increases in those age groups as well. The other thing that's important to note in this is the 80-plus age group. And we know that people who are over the age of 80 are more likely to have severe illness or to die from COVID, and that is reflected in the testing that we see here and in the case rates here as well. In particular, many of the people who are over 80 are seniors, are elders in long-term care, and the testing reflects the outbreaks that we've seen in the past few weeks in long-term care homes. Also very important that we've been following is our daily case rates, as well as hospital and ICU and deaths. And this is a reflection of the case rates in green with the markers of when we put in our most recent public health orders to try and decrease our social interactions. We saw a continued increase for the first 2 weeks, not surprisingly, after the orders were put in, as we know that many people in that group were already exposed. But what this does show us is that when we adhere to these orders, those case numbers do come down. And that is incredibly important for us to recognize. But we cannot let off. We've seen that happen before. If we look back into October, we were hovering along at 100 cases a day, and very quickly it spread rapidly. We're now leveling off in our hospitalizations, but they are at the highest level that we have seen this year. And tragically, our death rate has increased as well over the past few weeks. Another important marker that we follow very carefully is the age of the population and how the pandemic and the virus is affecting different age groups. The blue bars that we see in this figure represent the proportion of that age group in our population. So for under age 10, about 10% of our population in BC are children under the age of 10. The yellow bar next to that is the proportion of people who have COVID or have been diagnosed with COVID. And we can see it's about half of the population rate. We see a very similar thing, although slightly higher, in the 10 to 19 age group. But then if we look at 20 to 29, 30 to 39, again, it shows that cases are overly represented in those age groups. We also see that people who are more likely to have severe illness, to end up in hospital, in ICU, or to die from COVID are heavily skewed to the older age groups. We have had one person in the 30 to 39-year-old age group pass away from COVID, and 4 people 40 to 49. But really, the vast majority of people who have died from COVID have been 70 and older. Age remains the single most important risk factor for severe illness or death from COVID-19, and young people, children, are still underrepresented compared to their proportion in the population. These are things that we know are really important to help us understand the impact that going back to school has on the pandemic, and these are measures that we've been following. So most school-age children who have symptoms don't have COVID-19, and that remains the same as we have seen throughout the pandemic. With more than 600,000 students and educators back in our school system, this is something that we've been following very carefully. We have had many exposure events, and I'll show you some of that data in a minute, at our schools. And to remind people, an exposure event is when somebody who has COVID-19, who's been diagnosed with being infected with the virus, is in the school environment during the time when they could potentially be infectious to others. So we have been posting those regularly. It does not mean that anybody has transmitted the virus in those settings, but it's an understanding of how many people, how much risk we have in our school environment. And what we have seen is that even though we have exposure events that reflect transmission in our community, we have very little transmission actually in schools. School-aged children in the general population represent about 12% of our cases, and it has been fairly consistent, about 10 to 12% since the beginning of the pandemic. We have had 4 school outbreaks since the pandemic was declared, or since school returned in September. And just to put it in context, about 1 in 100 of school-aged children have been tested across British Columbia. And if we look at the general population, about 7% or 7 in 100 tests are positive. But if we look at the school-age population, that's much, much less. So even though 1% of school-age children have been tested, fewer than 7 in 1,000, or less than 1%, actually test positive for COVID-19. If we look at COVID-19 exposures, so not transmission, but exposures, we had 526 school exposures in just under 2,000 schools in British Columbia. That means that more than 7 in 10 schools have not had any people in the school when they've been potentially infectious to others. The vast majority of those, about 292, almost 300, have been elementary schools, and this includes both students and adults in the school system. And not surprisingly, the vast majority of our schools and the transmission, as we know, has been in the Lower Mainland, and the most exposures have also been in the Fraser Health Region and the Vancouver Coastal Health Region. We do have some updates, some detailed information from both Vancouver Coastal and from Fraser. And of the over 120,000 school-aged children, about 600 children or staff in the school system were diagnosed with COVID-19 and in Vancouver Coastal Health. So these are people who lived in Vancouver Coastal Health, but only less than 200 of those resulted in any exposure events in schools. So we know that people are getting exposed and getting sick with COVID in our communities, from social interactions, from attending events, from being in family gatherings, other gatherings, from many different situations in our community. And we know that very few of those go on to have even an exposure event in schools. And they had transmission in about 10% to one or two other people in the school setting. There have been no outbreaks in the Vancouver Coastal Health schools. So just to summarize, about almost 90% of cases, they acquired their infection outside of the school from primarily household contacts. Of cases in the schools, 2/3 of them were in students, 3/4 were in students, and 1/4 were in staff and adults in the school system. And for 90% of these exposure events, there was no transmission in the school. And most recently, with the investigations that we do in schools, most transmission events involve staff members to each other. As we know, adults are more likely to transmit this to each other. We have very similar data from schools in Fraser Health, where we have exposure events that have occurred in 384 schools. A third of these were in the Surrey school district, and we know that there's the largest number of schools are in the Fraser Health region, and the Surrey school district is the largest of those. Out of 384 schools, there were 12%, so again, very similar to Vancouver Coastal, had potential in-school transmission events where there might have been transmission to one or two other peoples within the school. And about half of those transmission events were in Surrey School District. So, and most of those were secondary schools. So that gives us a little bit of an understanding of what's happening in terms of the risk in our school system in the last few weeks. Having said that, this is something that we have taken very seriously from the very beginning. The importance of children and educators being in the school system and having that in-class interaction is something that we know is important for the long-term growth and development of our children. So it is something we've paid a lot of attention to. And in November, when we started to have some challenges, particularly in the Fraser Health region, catching up with exposures and exposure events, I pulled together a task group to look at this in detail and to make sure that we were learning everything we could from what was happening in our school system in September, October, November, and this month. So that's being headed up by Dr. Reka Gustafson and includes members from the BC Teachers Federation, from our Ministry of Education, superintendents, parent advisory committees, and principals, others in our school system. And I know there's a lot of anxiety about transmission in schools, about exposures in schools. The data shows us that we are not seeing schools being a place where transmission spreads widely. And that tells us that when the safety protocols that are in place in schools are followed, it is a very safe environment, and transmission is very unlikely. But we know it is challenging. We know that kids don't always want to wear their masks, even when they're in the hallways. We know that the cohort system in some places works better than others. And we know that there's been challenges in the adults in the school system. How do we make sure that we have transition safely, that teachers who are working in multiple different cohorts are able to do that safely? So all of this is being looked at, and we're looking at all of the best advice that we can to support schools and the school community when we reopen again in January. So moving on about some of the comparators that we like to present around how we are doing compared to other places, are the trajectory of our pandemic. As you can see, we are still, although our second wave has increased, we have leveled off in terms of daily cases per million, our 7-day rolling average, and we remain lower than many of the other provinces in Canada. As everybody else has been experiencing as well, unfortunately, our death rates have come up in the second wave. and we know that we are not out of the woods in terms of our death rates, given the impact that we have right now in our long-term care homes. This is a comparison of our case rates, our 7-day rolling average compared to other countries, particularly the US and Washington State, UK, Germany, and a number of other countries. And again, comparison of, unfortunately, our death rate compared to other countries. The other thing that I think is important for us to update is the modeling that shows us some of the scenarios that we have been through and what we might be facing in the future. So firstly, the modeling of our estimate of the reproductive rate, or the reproductive number, RT. And this, as you know, is the number of contacts that we have where the virus can be transmitted. So it's a function of the number of people we're in contact with during an infectious period and the number of people who go on to subsequently develop illness. And 1 is kind of the cutoff. So when we're above 1, we know that the outbreak can grow. And it can grow very rapidly with even small increases. And we've seen that in the past few months. But once you're below 1, that means that on average, an individual who's infected does not pass it on to anyone or passes it on to one person or less. So that is where we are now. We have just come down slightly below 1, and we're hovering there, which means what we are doing is working. But we cannot let up. We've also been able, now that we have increased numbers of cases, we can understand how this trajectory is working in different regions of the province. And as you can see, across the province, we've started to slow down. We've started to put in place those measures that mean that we're reducing the number of people that we're potentially exposing with every person, with every new case. This doesn't mean, though, that it's easy. It doesn't mean that we're out of the woods. We know that the contact tracers are still working very hard, particularly in Fraser Health, Vancouver Coastal, and the north, where it's been very stressful and strained across the north. The other modeling that we look at is around the scenarios of where we've been and where we might be in the future. As you can see, we have bent our curve slightly, and we're now perhaps on a downward trajectory. We did reach up to 800 cases per day, but that has slowed, and we're now moving downwards. But the background blue tells us that we need to be cautious, because we can very easily, the scenarios that the model shows us is that it would not take much for us to get back into a danger zone again. We are probably right now, in terms of our infectious contact rate, somewhere between the 40 and 50%, given these model scenarios. So this gives us a sense of what could happen, depending on our actions today and tomorrow and next week. So we can continue to bend our curve down to make sure that we're doing everything we can to prevent transmission, right now in particular, where we know we have vaccine that's starting to protect those who are most at risk. But it does not take much to tip us back over into the bottom scenarios, where this curve can once again rapidly take off. And just to end up our presentation today, I'd like to give a little bit of an update about what I just mentioned, the very positive fact that we have immunizations available to us now. So as of this morning, not only do we have the Pfizer-BioNTech vaccine, which has been approved for use in Canada, but Health Canada this morning also approved the Moderna vaccine for use in Canada and in British Columbia. And we have received word as of today that we will be receiving the Moderna vaccine next week here in BC, as will other provinces across the country. And that's important because the Moderna vaccine is more flexible in terms of the numbers of doses that can be broken down. It comes in boxes of 1,200 doses, but we can break it down into as small as 100 doses and take that out to different parts of our communities around the province. So that means we can start to address some of the urgent needs that we have to protect people in some of our remote and isolated, particularly First Nations communities, and also residents of long-term care home where we know the virus is causing the most damage. So the second thing that we had good news of yesterday was that we can start to move the Pfizer vaccine away from the port of arrival. So we have tested and improved all of the transportation systems to the point of arrival and from there to administration. And we've now got the go-ahead from Pfizer to be able to move some of the frozen vaccine to other places. So again, we have the opportunity now with the Pfizer vaccine. It's still a bit more challenging because there's only a limited amount of time that it can be outside of the ultra-low temperature freezer. But that means we can also use the Pfizer vaccine to start immunizing residents of long-term care homes. So those are exciting things that have happened just in the last couple of days. And as well, yesterday we had confirmed from the National Operations Center the numbers of doses of both Pfizer and Moderna vaccine that we will be receiving during the month of January. So all of this is incredibly exciting. When I talked on Monday, none of that was known yet, and there are still many different scenarios that we were trying to plan to without knowing anything for certain. What we have done is prioritized who will get the limited amount of vaccines that we know we will be receiving in the coming weeks. And we've also made the decision based on looking at all of the data, the modeling from BC CDC, and discussions of the ethical framework, that we will be providing the second dose of both Moderna and the Pfizer vaccine around day 35. So the recommended from the company is around day 28. But we know we can immunize way more people in the first couple of weeks with their first dose of vaccine and provide that increased protection for people during this very critical time if we just slightly delay when people start getting their second dose. So for people who received the vaccine last week and this week and in the first weeks of January, you will be called back for your dose around day 35 from when you had your first dose. And this helps us in terms of understanding and protecting as many people as possible during this period of time where we are still seeing a lot of transmission in our communities. So the estimate numbers of doses that we will be receiving between now and March is about 792,000. And with the strategy that we have adopted, that will allow us to provide about 549,000 people with their first dose, with the protection that we get from that first dose, which is incredibly important. And about 240,000 people will also receive their second dose. So our priority populations in more detail for this first phase. So for December, the vaccine that came last week, this week, and next week, and to the end of January. So this is where we're focusing our attention right now. And that's on residents, now that we can move the vaccine more easily, and staff of long-term care, which is approximately 70,000 people, residents and staff of assisted living, people who are in hospital right now, which what we call alternative level of care, so people waiting a bed in long-term care, essential visitors who have been designated in those areas, and healthcare workers who are key to the COVID response and also to protecting our healthcare system. So our two main aims right now are to save lives by providing protection to those who are most at risk and taking the pressure off our healthcare system so that we're able to provide safe health services for everybody in the province through these very stressful next few months. And as well, we are aiming to protect people who, if the virus gets into a remote and isolated community, it can cause a lot of damage and have very challenging times in terms of people being able to get health services, particularly as we're moving into winter. So we have identified, first off, 10 remote and isolated First Nations communities where vaccine will be sent to as soon as it arrives. After that, So this is going to be our sole focus for the rest of December and the month of January. As we get more vaccine and as we are able to protect populations, we'll be moving out from there to other priority populations, particularly people who are living in our community who are at risk, starting with seniors 80 and over, people who are experiencing homelessness using shelters and group homes. And we have seen that when this virus affects those communities, people are more likely to end up in hospital and to have severe illness and to put pressures on the healthcare system, our hospital system and our ICU. People who receive long-term home support, the rest of the hospital staff that are integral to our system, and additional people at risk in Indigenous communities. So that is our rather ambitious plan for the next few months. I'm excited and thankful and grateful that we have vaccines, and this is the start of our being able to protect people, particularly our seniors and elders who are so at risk in the coming months.